Hello, my name is Heather Webb, and I'm a healthcare navigator with Enroll Wyoming. This presentation is health insurance coverage and care for Wyoming individuals and families. This is all about health insurance, care, and coverage for yourself as well as your family. So many of you have maybe heard about Enroll Wyoming, but just in case, this is a good overview of what our program is all about. On the top you have our mascot, which is Bandage Boy. So whenever you see Bandage Boy all across the state, you'll know that that's where Enroll Wyoming Navigators will be. We're a grant program serving Wyoming. Our main goal is to assist individuals and families in exploring their options for health coverage and then whatever application processes are involved with your decision. Some of the coverage options we can help you with include coverage through the federally facilitated marketplace, which is the health insurance marketplace, Medicaid, Kid Care Chip for your families, Medicare, employer-based coverage. This is very much a consumer-focused program, so we want to make sure we are trying to meet your needs the best we can, and we're exploring all the options for you and your family. We also prioritize making sure that all of the information is accurate and up to date, so make sure whenever you're meeting with someone to explore your health coverage options that all the information is unbiased and accurate. All services are free of charge, and there's no qualifying or disqualifying you from receiving our services. So whomever you are and wherever you are in the state, we just make sure we help you out with exploring your options. You might see us at some of the events at Wyoming Department of Correction facilities, the offender resource fairs, mock interviews, and also the education programs like what you're in today. We also have a few other navigators on our team. That would be Miss Monica Jennings, Miss Cynthia Nunley, Mr. Caleb Perea, or Mr. Heath Frost. So we get to serve the entire state of Wyoming, and each year we are responsible to make sure we know how many people we have served and what we're really doing and the impacts we're having all across the state. And so this is your number. So for 2017, we had 24,826 Wyomingites enrolled in health insurance through the federally facilitated marketplace. So that number represents families and individuals that are receiving care and coverage through the marketplace. Why do I need health insurance? This is pretty important. One thing that we like to focus on is free preventive services. So things like your wellness visit whenever you're signed up through a qualified health plan. Make sure you're taking advantage of your free wellness visit. So that's something that you can go in and just have a conversation with your provider to talk about what your healthcare needs are and keep an ongoing relationship. Consumer information, accountability, and transparency. So you should know what you're buying and you should have the best information available to you, and that's something that we prioritize. And then also primary care provider versus emergency room. And so this also goes a bit hand in hand with the free preventive services. So we want to make sure you're establishing that relationship early. We know that when you go into a primary care provider versus the emergency room, typically you have less wait times and things like that. So it's a better care system to be able to go in and have an established relationship. So some of you have heard of the ACA. Some people call it Obamacare. Some people call it the Affordable Care Act. This is the name, the Patient Protection and Affordable Care Act, the ACA. That's what we oftentimes refer to it as. This is protections for consumers with pre-existing conditions. So if you have something, a health condition that would be designated as a pre-existing condition, you can no longer be denied coverage and you cannot be charged a higher premium or a higher rate just because of your healthcare needs or a pre-existing condition. There's also a component with the 10 minimum essential health benefits that equate to a qualified health plan, and we'll get into that. You also have the federally facilitated marketplace, and that's HEALTHCARE.GOV. And what that is an online shopping portal where you can compare plans and prices. So you can go to one place versus having to go to multiple places to see what's available for you. We also have advanced premium tax credits that can help you with those front-end costs. So your monthly cost to have a health plan, you can receive assistance to make that more affordable. And then we also have cost-sharing reductions, which help with really the back-end costs. So whenever you go in to see a provider or to have any kind of healthcare services, whenever you have to pull out your wallet, how much is that going to hurt your checkbook or your wallet? So essentially your deductibles and your max out-of-pockets. So now our primary focus is really making sure you also know what you're getting when you're buying a plan, because that's very important. If you're taking the time to enroll in coverage and you're paying money for coverage, you should know what is included in that plan. So now we'll move into the discussion of the qualified health plan and then the minimum essential benefits. So here it is. Essentially we have 10. The main thing is whatever plan you're buying, they need to have these 10 components in that plan. And so as you can read through these, some plans will cover them entirely, some plans will cover them up to a certain amount, and then you're paying some. It depends. But the main thing is these are the nuts and bolts of any health insurance plan. We talk about the financial part and the money part a little bit later on, but these are the nuts and bolts and the building blocks of any plan you should be buying. So make sure when you're getting coverage that they do have these 10 benefits included. That's something that we can definitely help you out with. The best way to look at this is, for instance, if you go in to see a doctor and they have to draw your blood to see what's going on, your health insurance should cover that blood work and that lab results, because that's part of your care system. Financial assistance. So you're going to see HEALTHCARE.GOV mentioned quite a bit throughout this presentation. One reason why is because sometimes people will go to healthcare.com or healthcare.org. Please make sure you do not go to those sites. HEALTHCARE.GOV is the place you want to go through so that you can take advantage of the tax credits as well as the cost sharing reductions. The advanced premium tax credits, again, that is assistance with your membership cost. So your month-to-month expenses to make sure that you have the health coverage. We go off of the federal poverty level, and to be eligible to receive the advanced premium tax credits, you have to be between 100 and 400% of the federal poverty level. And then with the cost sharing reductions, this again helps with those back end costs. So your deductibles, which is kind of like your first benchmark, and then your max out of pocket, which is really your safety net. You know that you're not going to go above or beyond that number within a year. One thing to remember with these is the advanced premium tax credits, the assistance, and then your premiums do not go into your max out of pocket. So essentially, you pay to play. You pay your premium, and then you get your cost sharing reductions and your back end cost associated with that. To receive the cost sharing reductions, the eligibility is you have to be between 100 and 250% of the federal poverty level, and you have to select a silver plan. And so on the top left-hand side, we have kind of the breakdown of the bronze, silver, gold, and platinum plans. And essentially that's how much are you paying on the front end, and then how much are you paying on the back end. And so oftentimes with the silver plan, your premium, so your monthly membership, might be a little bit higher, but you usually see a little bit more of a manageable deductible and max out of pocket, so those back end costs. It's something that we hear quite a bit is that health insurance is expensive, and so we do have information on here for you. Over 88% of Wyoming Marketplace plans selected use advanced premium tax credits, so that membership monthly cost assistance. The average premium reduction through the advanced premium tax credit was $506. So what that means is each month the government was paying $506 to an individual plan to make it more affordable. And so what that comes out to was the average premium after that assistance was $164. So it's important to explore your options for coverage as well as the assistance options, and we can help you with that. All right, so it all sounds great, right? Where can you sign up? Open enrollment is the period when anyone and everyone can go on to healthcare.gov and explore your options for health coverage for the next year. And so this year the open enrollment dates have changed, so this is very important to be aware of. The open enrollment dates this year are November 1 to December 15th, 2017. The good news is your coverage would then start January 1 of 2018. So that goes hand in hand with the beginning of the year. Again, open enrollment is when you can go on and shop and kind of look through your options. There's also special enrollment periods, and essentially special enrollment periods are times outside of open enrollment where you can go on and possibly sign up through HEALTHCARE.GOV. One of those times would be release from incarceration, and so that doesn't include transitional centers. So if you were leaving the facility at WMCI and then you're going to, say, the transitional center in Casper or Cheyenne or Gillette, what that means is you're now responsible for your healthcare coverage. And so once you are at the transitional center, you can then go on and see what kind of options you have for coverage. Something very important to keep in mind is you have 60 days after your first day, beginning your first day of when you get to the transitional center. So you have a little bit of time, and we know that you have quite a bit that you get to deal with and get to take care of during that first little bit of your transition, but making sure to call us is a good thing to have on your list to make sure we address your healthcare needs. Another one is change in zip code. So for instance, if you go from WMCI to then a transitional center and then you move from the transitional center, that's also now a new special enrollment period, because if you have changed zip code, that can also qualify you. If you've lost coverage, so say you are on Medicaid, for example, and you lose your coverage, you also qualify for a special enrollment period, and you have that 60 days. Some other things that could qualify you would be a birth or death in the household, marriage or divorce in the household, and then also an income change. And so with regards to this special enrollment period, if you are transitioning from WMCI or another DOC facility, and say it's late in the year, you still have that 100% federal poverty level that you need to hit in order to receive assistance. So sometimes what happens is you could not have coverage for a little bit, and then once your income hits that 100% mark, or we know that you're going to hit that, then you can go on and sign up for coverage, because before you couldn't receive assistance because you were outside of that income bracket, but now you can. So the main thing is there's probably going to be a lot of changes upcoming and things that you know might be happening in your life. So be proactive and connect with Enroll Wyoming navigators so that we can help you through that process. Okay, so special enrollment periods are kind of confusing. Making sure that you know that it's the time outside of open enrollment, that's very important. Keeping in mind and keeping at the forefront is the 60 days. So make sure really once you know you've had a life change, particularly tracking your move to a transitional center or maybe your income changes as well, make sure you're tracking so that you know when your 60 days is going to run up. If you have a health condition, if say for instance you've been receiving health care while you've been in a Department of Corrections facility and now you know that you need to continue your care, it's very important to connect with us prior to you leaving the facility so that we make sure you don't have a gap in coverage, because that's very important and we want to make sure you continue your care. Again, connecting with us, we can help you through these processes. Sometimes there are additional documentation that's required, and so we can help you with that as well. So members of federally recognized tribes, we put this slide in here because it's very important that members of federally recognized tribes know that there are additional options and some other opportunities available to you. So you do not have to adhere to the open enrollment period. So you can sign up any time of the year, and so that's very important. It's nice to know that you have those 60 days, after a special enrollment period, but really you don't have to adhere to that. So if you are a member of a federally recognized tribe, contacting us prior to leaving a facility is very good. That way, again, we can make sure you have continued care, but you do not have to adhere to those dates. Zero cost sharing. So the back-end cost that we were talking about, if you are between 100 and 300% of the federal poverty level, you have zero deductible or max out of pocket. So what that really means is when you sign up for a plan, you have to pay your monthly membership, that premium payment, but then you're good. You don't have any back-end cost. It's your responsibility to make sure you keep up with your monthly premium payments. But aside from that, when you go in to see a provider, you don't have to pull out your checkbook. Again, we have HEALTHCARE.GOV on here because that is where you need to go through to make sure you receive those benefits. This is also very important. If you sign up for a plan through HEALTHCARE.GOV, you can use that plan at IHS, at Indian Health Services. So that's very important that we're making sure that we're bringing in a payer system for IHS as well. And we realize the importance of IHS to Native American communities, and so IHS can bill your health insurance. So, employer-based coverage. Some of you, when you transition, will be applying to jobs or maybe already have a job lined up. If you're offered health insurance through your employer, there's a couple things to keep in mind, and if you have questions on that, again, that's why we are here. You need to make sure that they do provide the minimum essential coverage, so those 10 components that we talked about at the very beginning. This can be provided to just you or you and your family. There's a distinction there. Affordability is based on total premiums for 1 year for the employees. So if you think that the coverage is too expensive, it might be, and we can help you through that process to determine if it's affordable or not. The affordability changes each year, and so we're coming into a new year, but checking with us to run those numbers is a good practice. Many employed individuals have their children covered through Medicaid or Kid Care Chip, and so you can also go through that process. We can help you with that. So sometimes what we see is you might be covered under maybe an employer plan, and then your child or your children may be covered through the Medicaid or Kid Care Chip program, and that's perfectly fine. Medicaid and Kid Care Chip. One really great component of this program is all of the application go through one system. So the Wyoming Eligibility System, or WES, you can call, and the numbers are listed up here for you. It's about a 20-minute phone call to do the application over the phone. Medicaid has open enrollment year-round, so any time of year you don't have to adhere to those open enrollment periods, and as well as Kid Care Chip, they have open enrollment year-round as well. Kid Care Chip does have a little bit of a higher income guideline, but that's also an option, particularly for families that are employed, but the coverage for the family is too expensive, as well as for Medicaid too. That's also a good option. So, reliable information. We know that there's quite a bit of misinformation out there, and Enroll Wyoming's stance on this is really, we want to make sure that whomever is coming through the doors or whomever is looking for health insurance coverage, that you have the right information, because this is your health care, your family's health care, and that's the most important thing. And so we are a good resource. Wyoming 211, simply dial 211, and they can answer questions, and they can also refer you to us. And then also HEALTHCARE.GOV, the federally facilitated marketplace, are great places to go for correct and accurate information in the process. So, where to start? Something very important. Never assume the cost is too high. And so, say your neighbor has gone through this process and they said the coverage was too expensive, so you have decided not to look because of what your neighbor said. All of this is very much based on each individual or each household, so make sure you are protecting yourself and that you're exploring all the options with us to see what you can get for yourself, because each situation is very unique, and it is your health care, so you want to make sure you prioritize that. Be informed and explore all your options. Connect with Enroll Wyoming for assistance free of charge, and then again, make sure that you know that your special enrollment period really begins 60 days, the first day, and then 60 days out from when you have a life change. And then open enrollment period is November 1 to December 15th this year, 2017. So I'm not there, so I can't respond directly to your questions. But if you have questions, there should be an information sheet that accompanies this presentation You can write down your questions and have Mr. Wells submit them, and I'm happy to respond that way. You can also connect with Mr. Wells to see if he can have me provide any additional information that you need. Thank you.